Good morning, everyone. Thanks for coming along. Welcome to Exercise and Multiple Sclerosis. Today, your presenter will be Caitlin Jerkovic. She's an exercise physiologist here at MS Plus. I'm your facilitator. My name is Peter Butler.
Alrighty, so I am Caitlin, as introduced lovely by Peter. So I graduated my Masters of Exercise Physiology at ACU in 2022, and then luckily got the job here at MS Plus after my graduation in 2022 as well, as an exercise physiologist based in Footscray. So for our new Footscray site, that will be coming out shortly. I have got a large interest in neurological conditions and working with neurological conditions, as I do have a really nice background from placement and from prior work, which has been super great for me being able to come in here and work within this area. I guess what I find the most exciting about it is being able to find ways to use exercise to assist in improving one's abilities, improving their goals, and how we can improve their quality of life. So overall, that is something that I quite enjoy, and that's why I'm kind of within this field. So this is what our kind of outline will look like for today. So hopefully I don't go over time too much. So we'll see how we go, but we'll get started. So the age-old question of what is an exercise physiologist? I get asked this quite a lot, so we'll get to answering it. Here is the definition. This is by ESSA, so Exercise and Sport Science Australia. That is exercise physiologists' accrediting body. So essentially they define an AEP, so an accredited exercise physiologist, as a university qualified allied health professional equipped with the knowledge, skills, and competencies to design, deliver, and evaluate safe and effective exercise interventions for people with acute, subacute, or chronic medical conditions, injuries, or disabilities. Pathology domains covered by the services include cardiovascular, metabolic, neurological, musculoskeletal, cancers, kidney, respiratory, pulmonary, and mental health. And we do any other condition that also has evidence. So I guess breaking down what this definition means is that I know in some states it is a bachelor's degree, where for myself, in Melbourne, we had to do a master's degree. So that is 4.5 years of university that I've completed, as well as doing many, many hours of placement. We essentially then design, we create, we make sure that programming is safe for the person that we are working with. And we also deliver that exercise. So again, we are making sure that your form is correct. We are making sure that everything is going to be safe within this exercise program that we have created for you in particular. We can work with acute, subacute, chronic, and injuries and disabilities. So essentially we can work within multiple different fields of allied health. So that means we can work in hospitals, we can work in rehab, private practice, neurological. Pretty much we can work within any allied health field. And evidence that exercise can improve the client's clinical status. So we use a process called evidence-based practice. Essentially, we use multiple different research articles, and that can range from meta-analysis, randomized control trials, and systematic reviews, which are your 3 top-tier basis of evidence. And we use that to ensure that we are guiding our exercise prescription for this particular person based on their specific symptoms, their diagnosis, and make sure that the evidence is there to then obviously safely and effectively create an exercise program. That is the basis of that. We also like the saying of we use exercise as medicine. So that's also, I guess, another way of putting it into perspective of what we do. When we are now going to look at some benefits of exercise, because obviously as an exercise physiologist, we need to promote why exercise is so beneficial. And I like to really look at, I guess, what the difference between physical activity and what exercise actually is. So they're 2 different concepts, although quite similar in definition. So a group of researchers led by Casperson in 1985 created these definitions. And although 1985 seems a long time ago, they are still readily used and are very, very applicable to today. So when we're looking at physical activity, we're essentially saying that any type of movement completed that leads to the use of energy. It says specifically with skeletal muscles. So skeletal muscles are just your general muscles overall. But this can include your sports while you're at work, or even just completing your household chores or working around the office, doing those kind of things. Whereas exercise is specifically looking at planned, structured, and repetitive movements that look at the maintenance or improvements specifically of fitness, which includes those concepts of resistance training, aerobic training, flexibility, and balance. Having this distinguished, I guess, shows that there are many ways to expend energy, and just by completing daily tasks, you are therefore completing some form of physical activity. But then it also allows us to determine that exercise is still quite different and is still separate to you just doing household chores. It is a bit more planned, it is more structured, and it is on the basis of maintenance. So obviously when you're just completing physical activity, you're not really working to maintain at that point, where with exercise we are. So having those true different distinguishers will allow us to kind of see what we mean by when we want exercise. But I guess looking at just the holistic benefits of physical activity and for exercise, just for everyone in general, is that physically we're looking at reducing the risk of comorbidities. So comorbidities are essentially the presence of two or more diseases, which can include things such as high cholesterol, high blood pressure, diabetes, obesity, etc., etc. So exercise reduces the risks of those onsets, as well as reducing the risk factor associated if those conditions are currently present. So whenever we look at working with diabetes or looking at with high blood pressure, those lifestyle changes do include that exercise. And so it is important to acknowledge that we will be reducing the risk of obtaining it, as well as reducing the risk of even when we are currently living with it. There are also the factors such as increased balance, mobility, strength, cardiovascular capacity, while also reducing fatigue. So they're the main physical benefits that we kind of have when we're looking at physical activity and with exercise. There's also the social aspects of exercise, which I think kind of don't get shone on quite a lot. And I think that they're really, really important when we're looking at what exercise does for people for their social health. But it essentially allows us to be able to work with other people in similar situations, and that may be in gym groups with people that, you know, all have MS or all have another neurological condition. But it also allows you to socialize with your therapist and get along with them, and hopefully helps reduce that risk of social isolation. Exercise also aims to improve one's confidence in their capabilities, and therefore assisting in people getting out into like the social settings. So that could be parties, that could be going out for lunch with someone else. So bringing in that confidence will hopefully be able to enforce that kind of coming. And lastly, the mental benefits. Exercise has been shown to be exponentially important in mental health. And overall, it shows improved mental well-being, including the reduction of depression and anxiety symptoms. Well, it also assists in helping with cognition. So that means things like we can do dual tasking, we can do cognitive exercises such as memory or counting backwards as you're doing a task, as well as things such as balance and stuff like that. So overall, there is lots of things that exercise is super beneficial for everyone. But when we look at more, I guess, generalized neurological conditions, so we're not being specific to any neurological condition here, just in general, we can see that there, again, are many benefits to it. So exercise training, such as resistance training and specific balance training, benefits gait and balance, especially with people with asymmetries. So those asymmetries can include strength and balance and coordination deficits. So if you're noticing those kind of things, resistance training and balance training is super important. Increasing fitness levels though through exercise may slow memory loss and brain atrophy, which is super important for more CNS related neurological conditions. So again, CNS is more specific to brain, brainstem, and your spinal cord as well. So exercise has shown to be quite beneficial in reducing that brain atrophy, which is really, really nice news. Exercise also helps to build muscular strength and aerobic endurance to optimize function and to prevent deterioration. So, one of the many goals that whenever I've spoken with someone is to prevent that deterioration, or it's to optimize that function that you can kind of have within your home. So, whether that be with ADLs, whether that to be like, I kind of just want to be in my maintenance phase here, I just want to try and stay as strong as I am within this period of my life. And that is one thing that exercise can really provide for people, which is super cool. We also want to look at including neuromotor training, so we can allow for enhanced motor control, greater dexterity, and an increased level of fitness of balance, sorry. So again, when we work within that motor control, that may mean working with things such as grip strength. That may mean working as things such as your fine motor skills, your balance. So we really want to work within those motor controls to make those aspects seem quite a lot easier. And there's lots of those things that neuromotor training does, which is super beneficial. It also highlights how we can maintain independence, reduce falls risk, and reduce fatigue. So again, independence is such a massive one, same as reducing your falls risk. So exercise physiologists and just exercise in general are super beneficial in helping assist in managing those and reducing that falls risk or maintaining that independence. So when we're coming up to some more MS specific benefits of exercise. So I've got two different categories that will be coming up. First, we'll be looking at these ones called disease modifying effects. When I was looking at this kind of research, I just want to note that it is quite new and therefore it is quite limited. So as you can see down the bottom for that reference, it is 2019. So again, it is a little bit more limited, but there is some really positive information that is coming out of these research studies. Essentially, what it is saying is that exercise can be disease modifying. So essentially what it's saying is that exercise has a neuroprotective effect on the brain, which can lead to a process called neuroplasticity. So what neuroplasticity is essentially the brain's ability to form and recognize connections in response to learning. So therefore, this implies that there's the possibility of, again, slowing down or reversing of brain atrophy, as well as increased connections to certain muscle groups, all that kind of thing. So there is that process of learning. So it's exciting to see that this is a possibility, and hopefully with more research and more time to be given to this, we can hopefully find out that this is 100% the case, and we can really see that exercise is really, really beneficial. But the other thing that exercise does really, really well is symptom management, specifically for MS. So exercise has been highly regarded as a very good manager of those symptoms. And there's obviously very different types of exercises that benefit different types of symptoms. A few different examples of exercises that positively affect the symptoms include continuous cardiovascular training or high intensity interval training that can lead to the management of fatigue. Neuromotor training can lead to things such as dexterity, dual tasking, and balance, and they all can lead to improvement in cognition and, again, those balance impairments. Strength training can lead to improvements in, again, that reduced muscular strength and how we can improve our muscle strength, whether that be lower or upper body. And overall, all exercise will lead to an improvement in mental health. So it shows us that exercise is super beneficial in that symptom management. So we're now going to start the process of looking at some guidelines around exercise. So today I'm actually going to go through 4 different guidelines that will be like just seeing, and we're just going to see the difference in how they all vary in specificity and what they recommend. So up first, we have the Australian Physical Activity Guidelines. So these are the ones provided by the government that you can literally find on the government website. And essentially, these are always going to be the basis of what all exercise prescription will be on. The guidelines state that although there's nothing specific for neurological conditions with these guidelines, they do state that there is no formal guidelines for people with disability, but being active is important to stay mentally and physically healthy. And this is also with the aim to reduce the risk of other conditions and to maintain healthy levels like blood pressure and cholesterol. So again, it's addressing those comorbidities. It's not necessarily how they can help with neurological conditions and what benefits there are for neurological conditions, but it's essentially saying moving is going to be better than doing nothing, and reducing those comorbidities is essentially the aim. The aim is to try and meet these physical activity guidelines for your age group and then adapt to what is suitable to you. So that is what the exercise physiologist will be really good at, is adapting to what you are capable of doing. But overall, and just generally explaining what these guidelines are saying, is that being active most days is ideal, but achieving 2.5 to 5 hours of moderate intensity exercise per week, or 1.25 to 2.5 hours of vigorous exercise a week, should be sufficient enough to reduce those comorbidities. And again, that resistance training, so that strength training for 2 days a week, will also be really, really important for this. Up next, we have the MSRA guidelines. So this is off the Adapted Lifestyle PDF that you can get for free online, and I've actually got the link down further in our resources. But essentially, this is the MS Research Australia guidelines. They are guidelines that are adapted from another type of guidelines, which I'll actually show you shortly. They provide basic recommendations on how much physical activity and how much exercise allows, for how much they should be doing for the level of fitness or your level of disability. So they highlight the differences in fitness level and disability, and again highlight the number of days they recommend. So what I like about it is that you can see up the top here is that they recommend for 18 years and older with mild and moderate levels of disability. And it also says down the bottom that severe disability. So they have options for both mild to moderate as well as severe, which I think is really, really nice to kind of see. Looking at the general level of fitness category for someone with mild to moderate disability, they again recommend aerobic exercise for 2 to 3 days a week and moderate strength training for 2 to 3 days a week. They also, again, provide examples of what type of exercises to do, which is really, really important to just, I guess, to be able to visualize what is included within that. The next ones we have are the Canadian Physical Activity Guidelines for MS, which goes again in a little bit more detail from the MSRA ones. These guidelines are for adults aged between 18 to 64 with minimal to moderate disability resulting from relapse remitting or progressive forms of MS. So again, it's being a little bit more specific than the previous. This time, these guidelines will recommend 2 days a week for aerobic and 2 days a week for strength training. So a little bit less than the previous. They also then highlight the FIT principles. So the FIT principles are essentially frequency, intensity, time, and type, or as they've put it, how often, how much, how hard, and how to. What I like about having this included in it is it allows for a bit more specificity and a bit more information about each kind of detail. When I was looking at these guidelines, I found a study by Canning and Hicks in 2022 where they completed research on how effective these guidelines are, which showed that following these guidelines for 12 to 16 weeks resulted in a reduction of fatigue symptoms, improvement in their overall fitness and mobility, and increased one's quality of life. So it shows that these guidelines are really effective, which is nice to see that if you are to follow them, there are going to be large benefits coming out of it. But again, we can kind of see 2 times a week for that aerobic and that strength training. We then also have our how much. So it shows us our time of minutes, what we want to be doing. So here it says 30 minutes for aerobic, where here it shows us the repetitions and the sets of which they require. How hard is our intensity? So looking at moderate intensity or vigorous intensity, I'll be going into a little bit more detail about what that kind of means later on. And then again, lastly, our how-to, so our type. So what types of exercise can you actually be completing for each of those kind of categories? The last one that we'll be looking at is actually off of a research paper, and the paper itself is called Exercise and Lifestyle Physical Activity Recommendations for People with MS Throughout the Disease Course, which I really like because, and these ones are a little bit even more specific, but I really like them as they're based off the EDSS score, which you may be getting from your neurologist or you've gotten from your neurologist before. Essentially, these guidelines go from 0 all the way to 9, which gives us a really nice broad range of seeing what we can see with someone who's got more mild, more moderate to mild disability to more severe disability. So these guidelines reflect the minimum exercise and lifestyle targets for people with MS. And they did note that starting points of exercise capacity will differ depending on your prior exercise history and your level of individual disability. They've also stated that as disability increases and mobility is more challenging, they do recommend the use of an exercise professional. So I'm going to go through only 3 different types of categories that are on here. So we'll only be going up to 7.5 for these ones, just as a quick, I guess, just look at what these kind of guidelines are. So this first one, we're looking at 0 to 4.5. So here they recommend aerobic and resistance training 2 to 3 times a week for each category, as well as including flexibility and neuromotor training, which is the only recommendations which include that balance specific training or that more dexterity training, as well as including that flexibility, which is why I like these guidelines so much. They also include the FIT principles, as explained previously, as well as example exercises. But I also like that they include key messages that have actually been researched with this one in particular. So they've stated that exercise may temporarily worsen symptoms if they have someone who has heat sensitivity, and even supervised training generally provides better results than non-supervised training, which has also been researched and highlighted as a key factor that supervised training is greater. So one other aspect also is they have your advanced strategies. So why I like that is obviously someone's level of fitness may vary quite largely. And it shows that, there is the option of being, in a bit of the your normal kind of category, but also that option of, okay, we can improve here. We can get into some running. We can get into some tense exercise. So it's really nice to see that they're not limiting people to just moderate, which is quite cool. It also highlights as well that things like Pilates, dance, and yoga are also really, really nice for people with MS, which is really, really cool. So up next is the EDSS of 5 to 6.5, and this category is, as they've said, the same. So they're not sitting there saying that people even up to 6 have to alter their exercises too much. They're saying literally you can do the same thing all the way up to 6. They do just have a few more points in saying that exercise is possible with increasing disability, but when balance is more effective, that altering the environment and making it a little bit more safer will reduce that risk of falls. They also have things such as expert opinions. So this is not necessarily research based, but this is from people with lots of previous experience. And they've just brought out a couple different things as well, which is quite nice to see. And our last one of our EDS of 7 to 7.5, here we can see the recommendations have changed as the level of disability is now within the ranges of diminished ability to perform ADLs and non-ambulatory. So these recommendations change via including breathing exercises every second day, flexibility, and upper body exercises. So they note that exercise should be completed for up to 20 minutes and can be done 3 to 7 days a week. And you can actually, they also say you don't have to do 20 minutes all in one shot. If you need to do 5 minutes, 5 minutes, and take your time doing that throughout the day, that is also completely more than fine. They also notice that an exercise specialist should be in at around this level of EDSS. Overall, all the guidelines show very large similarities, but change in their level of specificity. They highlight the importance of maintaining some movement daily and all highlight at least 2 to 3 days of aerobic exercise and 2 to 3 days of resistance training. So to summarize those guidelines, we're going to answer the question of how much exercise, how much physical activity should be recommended. So we've got this lovely table here, which has split up into our FIT principles of frequency, intensity, time, and type will be explained further down as there's just a little bit more information. I've also separated the categories of aerobic and resistance just so that it's a bit more easier to see. So first up, as explained previously, the recommendation of aerobic exercise is 2 to 3 days a week, an initial intensity of moderate before progressing to the option of high if you are interested in that. It can be completed for as little as 10 minutes a day, or you can push it out to 30 minutes a day. But again, highlighting anything is better than nothing. So if 5 minutes is all you are capable of doing, that is better than nothing. Looking at resistance or strength training, the recommendations state a minimum of 2 days a week of resistance training. And again, that moderate to vigorous intensity, depending on where you're kind of preferring it. This time, we're not necessarily looking at the time of a session. So obviously, some clinics will do 45 minutes, some will do an hour, some will do 30 minutes. But ideally, the recommendation is based off the number of exercises, which they recommend 5 to 10 exercises. They recommend 1 to 3 sets and 6 to 15 repetitions. So what that means is you're essentially going to be having at least a minimum of 5 exercises within your session. And for one exercise, you could be doing 10 repetitions for 3 sets, and that will equal to a total of 30 reps. We set it up this way so we can have that rest period included. But I also want to note that that also implies that doing one set of 6 reps is also within the guidelines and is within the safe ranges of completing that movement. Flexibility, the recommendation is daily at a light intensity for at least 20 to 30 seconds each stretch. So this can include as many exercises as you would like, but often prefer working within the areas that are more affected. And lastly, neuromotor. So this type of training is recommended to be completed 3 to 6 days a week. The intensity can be varied depending on the exercise, and the time can also be varied for 20 to 60 minutes. I say this in a terms of vary because when we look at how an exercise session is run, and for me, myself, this is how I kind of like running my sessions in a way that we can kind of tick off each category. So we've got an hour session. You may be completing 20 minutes of strength training, which essentially then ticks off this one here because you can hit 5 exercises within 20 minutes. That is more than capable. We are then going to be then doing 20 minutes of balance training or neuromotor training. So then we're ticking off our neuromotor category. We'll then go for a 10-minute high intensity workout or a 10-minute continuous cycle. And therefore we're hitting our aerobic category before we then finish up our last session with a cool down, and we'll do flexibility and our stretches for the next 10 minutes. Again, ticking off our flexibility. So we can complete all of one day's worth of exercises within 1 hour. So seeing this information may look scary initially, but it is quite doable. So I explained and I spoke a lot about intensity within the last couple of slides. And I guess why it's come up quite a lot is it's quite important for exercise. And level of intensity is important to note when we're looking at cardiovascular training and identifying the difficulty of an exercise, and therefore also identifying the load and whether or not you're now finding this task easier. So when we look at intensity, we use a scale called RPE, which is your rate of perceived exertion. So this scale usually includes a numerical scale of how hard you're working. So there's 2 different types, and I've got them both on the screen here, with the one on the left being 1 by Borg. And this uses a 6 to 20 scale, which is beneficial for being a little bit more specific, as well as being highly used in research and a great method of identifying one's perceived intensity. The second scale is the 1 to 10, and it's a little bit more simplified, but it's also really nice and easy, especially for cardiovascular and if we're not doing more research-based stuff. If you're working with an exercise health professional or an EP, you may always get asked this question. So, like, what is your RPE? And it's important to let them know what this number actually is and really express the truth within this answer, as it allows us to guide your exercise prescription better and to identify improvements within your capacity. An example how this can be used is, say you're on the bike, you're completing continuous cycling, we're going for 30 minutes. This allows your therapist to identify the level of intensity that they want you to work at. So, say we're doing 30 minutes, we want you to work between a 4 and 6 out of 10. This then allows you to have that nice number in your head, and you can sit there and scale that to what your level of capacity is. It also allows us to identify the level of difficulty at the end of the session. If you were able to maintain the 4 out of 6 the whole time and then you were fine with that, that's perfect. But if that got more difficult towards the end of the session, it shows that, there's a little bit more work to do, kind of thing. So it's a really nice measure, and it's something that should be in your head slightly if working within that 1 to 10 or looking at that 6 to 20. Up next, we have our type. So this is the one that I removed from our Fit Principles table up above. So up the top in the red box, we have got just, I guess, a wide variety of different types of exercises that you can do for each category. So for your aerobic, you've got like running, you've got walking, you've got cycling. There's also the option of an arm crank. There's lots of different variations. But then you go to balance, and it's things like working on your single leg balance or having your eyes closed, so making like your vestibular and your ankle balance called proprioception work a little bit more, or more dynamic balance. So things relating to like walking and balancing while there's movement within your body. So there's a couple different examples up the top. But when we get to our blue table, this is kind of what you'll be maybe getting from an exercise physiologist. Something similar, it may not be exactly the same. So the programs will always be tailored to the individual with the aim to address any weaknesses or limitations, and then alter the programming to one's capabilities. Always upon initial assessment, you will be asked what your goals are, and then that program is tailored to your goals, your needs, and your concerns. So we first off have some examples of movement. So I've not done it off. This is just off a random couple of exercises, I guess, just as an explanation. So say we're choosing the hamstring area. So we want to strengthen up our hamstrings. I've prescribed an RDL as an exercise. We then move on to how we can then complete your movement nice and safely, as well as with proper form. We do that before we even start our sets and reps. And then once that's all ticked off as being completed and well done, we then go into starting it. So again, we've got our sets and reps of completing 8 repetitions of the movement 3 times for a total of 24 reps. So that is what that RDL will be looking like. We then also have our intensity and our weight. So the intensity, as we saw previously on this table here, we'll be using the 1 out of 10 scale, and that is just the rate of intensity that we want you to work at, as well as the option of weight, because when it does come to more resistance training, weight is inclusive of intensity. As you can also see, we also have progressions, which highlights that when the exercise becomes a little bit easier or more difficult, we're able to adjust the programming to suit your ability. So say for that RDL, you're finding that now super easy to do. All right, we can now progress that movement to a deadlift. Whereas if you're now finding that RDL too difficult, okay, we can now regress that to a seated hamstring curl or a movement called a good morning. So it allows us to be able to adjust as required. The other thing you'll note is the safety notes that I've put onto this screen. So reason why I like including safety notes or explaining safety notes is mainly for those that will be taking home programs. So having a home program versus a gym program. And it's mainly just to really focus on the idea that safety is the main important thing when it comes to exercise, and how can we make you do your form correctly? How can we make sure that you're in a safe environment if you're challenging your balance? All those kind of things when you're at home. When you're at the gym, It may be something as simple as your therapist will be spotting you, kind of thing. I also have the option of seated ones. So here are some more examples for seated for someone with a wheelchair or reduced or lower body strength. So again, it shows that it is available for anyone and everyone to do. And this is highlighted through the cardiovascular example, where we're now on the arm crank instead of a cycle. And also for balance. So instead of doing single leg balance, we're now focusing on that postural balance, which becomes more important when it comes to being in a wheelchair. So goals are also very important when it comes to looking at exercise. It helps provide guidance and specificity for the therapist to create your program tailored to you. So we often use SMART goals, and SMART goals are an acronym help to, again, set that specific goal. So we want to look at ways that we can make it super clear that one, we want to make sure that you are planning and looking at whether this is relevant for your future and what you want your future to look like. So therefore addressing the relevancy and the specificity of that goal. Two, we want to make sure that we can measure our progress as regular feedback of our goals has been recognized as beneficial. Three, is it an achievable goal and is it realistic that you can actually achieve this goal? And lastly, setting a time frame to reach and then including short, mid, and long-term goals can facilitate in helping reach your set goal with the inclusion of some behavior change. So not only does this allow for the clinician to be specific in programming, but it encompasses, but by encompassing the acronym, as well as feedback, planning, rewards, short, mid, and long-term goals, we've been able to recognize the influential aspects of setting these goals and therefore hopefully change one's behavior. And by changing one's behavior, I also mean motivation, so allowing for increased motivation. And that comes up nicely for our exercise barriers. So our barriers are obviously things that will come up, and we're only going to go over these just briefly, as I know there's lots of information out there on them, but again, it's nice to just go over them quickly. So heat sensitivity is obviously very common for MS, as well as there being cold sensitivity too, but it's not as common I've seen. So essentially we want to look at cooling garments, and that may mean vests, that could mean ice packs, including air conditionings within your house or fans within the gym, or even air cons in the gym as well is quite beneficial. Water and sprays, so ingesting nice cold water has been seen as super beneficial, and water sprays are just in general cooling you down. When it comes to exercise, making sure you're taking frequent breaks so that we can bring our heart rate down and therefore cooling ourselves down. I know with sometimes heat sensitivity is a little bit difficult to avoid, as obviously weather, so especially in Melbourne, the weather can be very temperamental, but it's about ways that we can adjust. And I also just want to note that no one, not anywhere, an exercise physiologist will not be upset with you if you come into the session feeling a little bit more fatigued, a little bit more weak just because of this heat. We'll work to what you're capable of doing within that session, and I guess what you're comfortable with doing within that session as well. Obviously, fatigue is another big factor, and there's been identified many ways of, I guess, how we can manage that. So maximizing your energy, such as increasing sleep, reducing stress, anxiety, eating well, managing and building up a routine for regular exercise is a really clear and simple one that we can do, but is often difficult to complete. There is also planning ahead and pacing, and that's why I like this image on the right of the slide of the spoon theory. So if you've not heard of the spoon theory, it's essentially saying you've got 12 spoons to use in a day. How would you use them? So as an example, say we're going to the gym today, you need to get out of bed, get dressed, and take your medication. That could be 3 spoons. We then will go do exercise, which is your 4 spoons, and then, come home, make a meal and eat it. You're already at 11 spoons within the day. So planning yourself out, it gives it just a really nice, I guess, a visual aspect of how we can do it, as well as just a nice perspective of putting it into place. So the spoon theory is a really nice thing to think of when it comes to, okay, I've got to plan my day ahead. How many spoons do I need to use, kind of thing. Other tools that can include is rest breaks or planning naps. When it comes to exercise, it's including those rest breaks again, switching out muscle groups, and finding out whether morning or night is better for your fatigue. Overall, managing fatigue is tough, but there are ways to address it. Reduced mobility is often another reason why people avoid exercise, and this is not necessarily a way to manage it, but more of a reiteration that there is always something that you can do. So not being afraid of being asked, like asking for help if you need it, and coming and seeing an exercise physiologist if you are unsure, because again, something is better than nothing, and working on the areas that are troublesome will be super beneficial for you. Motivation is always the killer, and I myself struggle with it as well. But there are a few different ideas that we can implement. I'm not going to go through all of them because they are on the slide, but a couple of my favorites are implementing exercises into your spare time. So waiting for the kettle to boil, or waiting for your pasta to cook, or brushing your teeth, and completing balance exercises or strength exercises are really easy to put into this time frame. I always like exercising with music or podcasts or even videos, and that's something that I use myself that I see as beneficial. Getting your families involved or friends involved and getting them to drag you out for moral support is always a way that I've seen work. And again, that goal setting that we were kind of talking about before, which really brings out some of that motivation with things such as feedback, planning, and setting some nice timely goals. And lastly, apprehension. So starting exercise can be scary. So it is more than okay to feel that, just knowing that exercise is safe and beneficial. And if you're unsure how to start, like it's good for you, you probably need to do it. Don't be afraid to ask for help. An exercise professional will help guide you and help build that confidence for you. There's also the option of group classes, as you are able to see other people in the same situation as you completing that exercise, building that moral support as well for you, and giving yourself accountability to get to those sessions. To finish up, what does it mean to engage with an exercise physiologist? It allows us to get objective measures of your current level and allows us to see any positive or negative changes that are coming on and how we can then go forward with that. They provide guidance on exercise, motivation techniques, and other ways to build routine into exercise. They assist in providing semi-regular or regular reviews with the option of weekly catch-ups, monthly catch-ups, as well as 6 monthly reviews of those results that we got with those objective measures. It also allows for a tailored program specific to you and to your goals. And if you are interested in exercise physiology, contact MS Connect and they will send you through to the right path. So a couple of resources, again, that Adapting Your Lifestyle Guide, which has those MSRA guidelines in it. You can find an exercise physiologist using this link, but you can also contact your GP, go through the NDIS or through My Aged Care. And the MS Plus Resource Hub has plenty of information about exercise and other videos like this that will show you some information. In summary, doing something is better than nothing. So finding ways to move within your day will largely benefit you. If you're following the guidelines, 2 days of cardiovascular and 2 days of resistance training is your basic measure. Going off that will be better than nothing. Setting those specific goals is super beneficial for getting a tailored program, as well as creating that motivation to move on and to get those exercises going. All barriers have a way of being managed and or overcome. So ask for help, ask for those professional advice from an EP. And also an exercise physiologist or other allied health professionals will focus on you. So getting that tailored program, getting that support from them is the best way about it. And there's the references, and there we go.
Amazing. Thanks very much, Caitlin. I'll just change over to my screen just quickly, and hopefully you'll be seeing my screen. So thank you very much. And so we've probably got time for a few questions. So I might just jump into a question here, if that's all good with you.
Really?
So someone has asked, how do we know how much exercise to do that won't bring on our fatigue? And how do we exercise in those days that we are feeling debilitating fatigue?
It's a good question, and it's always a tough one because a lot of the time it is a bit of trial and error. So, and that's why getting to know an exercise physiologist is super beneficial. But we often really just like to work within what you've recognized as. So, say we may do an hour session, but we really try to manage that fatigue within that session. So, including those rest breaks, making sure that you're okay. And again, if you've got that good relationship, that therapist should be able to recognize when that fatigue is onsetting. On those more debilitating days, it's a little bit tougher because obviously that motivation comes into it. And again, that mentality of doing something is better than nothing is really the idea. So getting up and just doing some stretching or going out for a small walk or just doing some light body weight exercises is again going to be more beneficial than nothing. So it's just having that notion in your head because again, it's like the use it or lose it mentality. So doing some stretches is going to be great for you.
Perfect, thank you. And just another one here. What is the difference between an exercise physiologist and a physiotherapist? And when should you see either? And also, do those two professionals work together? Can you see one and then the other? Yeah, just a bit of clarity around that.
Yeah, 100%. So physios and EPs obviously do get very mixed up, and that's completely normal. We're quite used to that now. So essentially, when we think of an EP, we're looking at really exercise specific based stuff. So we are unable to diagnose any conditions. We're not able to diagnose if you've got anything like that, but we completely specialize in exercise. When it comes to more physiotherapy, they're looking at that manual treatment, they're looking at diagnosis, they're looking at walking aids, they're looking at those kind of things, specifically within MS Connect and with the MS Plus anyway. We can absolutely work together. So myself and Mahendra, the physio here in Footscray, regularly see clients either at the same time if it's easier for a home visit, or we work well together in balancing their prescription. So it's often a lot of the time I'll see someone for 3 weeks and Mahendra will see someone for 1 week. So that's how we kind of like to split it up with EP. So there is large differences. When it comes to a point of needing to handle on, it'll be if there is it's something that an EP will not be able to diagnose. So then we'll send you on to a physio to then go get that confirmed. And then once they're comfortable, they're set with that, they'll then pass back to the EP to then keep that exercise going to prevent that injury from occurring again, if that makes sense.
Absolutely, makes a lot of sense. So thank you. And I think that's probably all the questions we can get to. I'm conscious that we want to finish up at 11:30. So thank you so much, Caitlin. And yeah, it's super informative in engaging presentation. So I think I've had some good feedback that's come in already. So, people do get a lot from it. So thanks very much. And I might just run through the final few slides. So I just want to chat a little bit about the services that we do offer here at MS Plus. So Plus Connect, which is the gateway to all our services. And if you do want to hear any more about any of these services that I mentioned or that you see on the screen, or you just need some support, then please do ring Plus Connect or email Plus Connect as well. And I'll give you those details soon. So I'll just run through a couple of our services. So Plus Education, that's you're involved in that today. So we run live webinars generally once a month. We are releasing podcasts regularly, and we will be releasing them more regularly from here on out. So please keep an eye out there. Plus Advisor. So we have nurse advisors that they do amazing work. If you do want to speak to a nurse, it can be about anything. It can be If you've got some questions around medications, if you've just got any symptom worries, if you just want a chat, to be honest, they are there. They're great. I overhear them every day, and they're really supportive, and they're full of great information, and they're super experienced as well. So please do ring up. And we also, as Caitlin spoke about today, we have a range of different allied health professionals. So we have occupational therapists, we have social workers, EPs, physios. So if you do need any of those services, please ring up Plus Connect, and we can link you in there. As I spoke about, these are some of the resources we offer. So head to our resource hub on our website, and you'll there'll be a great catalogue of webinars, podcasts, and articles. So if you do need any more information or support or help in any sort of areas, just go into the resource hub. You can search a keyword, or you can look up certain resource types. So please do go visit the resource hub. There's some great information there. And as I said, here's the details for Plus Connect. So call on 1-800-042-138, and that's anywhere but any time between, I think, 9 and 5. I could have that wrong, but yeah, please do call, or you can absolutely email us at connect@msplus.org.au. So as I said, they're the gateway to any service or any information that we have. So please do give them a call, and they are very, very helpful and knowledgeable as well. So I just want to say a huge thank you again to Caitlin. That was a great presentation, and also thank you all for coming today.